Good to see you, Mr. Secretary. Thank you for being here. In 2003, Congress established the Rural Community Hospital Demonstration Program to test an alternative payment model for rural hospitals that were facing certain financial constraints with the Medicare's Inpatient Prospective Patient Program, the IPPS. And Congress has extended the program several times, most recently in the Consolidated Appropriations Act of 2021. But Mississippi ranks among the states with the highest rate of hospital at-risk closings. This demonstration program could serve as a means to keep their rural hospital doors open to serve their communities in need of high-quality health care. However, CMS has not solicited applications since 2017, despite, as I understand it, there being a handful of open spots in the program. Do you believe this program has been helpful to rural hospitals facing closure, and we should extend the program when the time comes?
Senator, thank you for the question. The Rural Emergency Hospital designation extended a lifeline to some of these facilities. It is absolutely essential that we give hospitals that are willing to stay open a chance to survive if the older version definition of how they could get reimbursed isn't working for them. So we look forward to working with you because we've got to figure out a way to keep some of these facilities open and operating.
Do you know about how many spots are currently open right now in the program?
I don't have that with me, but I can make sure my team follows up with you.
No problem. And can you commit to working with me to solicit applications for the program and find ways to help us keep these hospitals open?
Absolutely.
I talked to administrators this morning that have been in my office, and we are constantly battling this in Mississippi. You know, we're just putting out one fire after the other. Mississippi has consistently seen some of the poorest maternal health outcomes in the nation, made worse by high rates of chronic disease and limited access to specialty care for many mothers. And we've also led the nation in infant mortality, something that we're not proud of at all and very concerned about, but it's driven largely by a very high preterm birth rate stemming from lack of prenatal care. Access to maternity care in rural areas is a major challenge, and we are seeing a rapid expansion of OB deserts, that we refer to them as, across Mississippi. In some areas of my state, women are having to drive more than an hour for any kind of obstetric care. How can we work with you to improve outcomes for our mothers and babies in Mississippi?
Senator, because everything you've said I agree with regard to maternal health, and especially how it's impacting our Black and Native American communities. The most important thing is early access. And as you've mentioned, sometimes, especially because a state like Mississippi has a lot of rural communities, it's tough to have access. And so that's why it is so important to not allow any existing health facility to go under in rural America, because then the access becomes even more difficult. Telemedicine, telehealth is going to be very important for communities, families in rural America, because it means they can have access without having to do the physical travel. We'll continue to support that so long as Congress gives us the flexibilities to offer telehealth flexibilities. But the most important thing is access. And I will simply say here, many of the women who are having bad outcomes could have qualified for earlier care had they been eligible for Medicaid. And I think if we expand Medicaid in some of the states that haven't yet done it, about 1.5 million more Americans, many of them women who want to deliver a baby, would have access to early care and not wait until it's a difficult circumstance in the delivery.
Yeah, well, I appreciate your concern and your willingness to help toward this, because it truly is crucial. Mississippi's a large state. We don't have many people, but we're a large state.
Yes.
And we're scattered. And it is truly a hardship on so many mothers to actually get to that care. We have a lot of babies born in cars, sad to say. My time is out. Thank you.